So thanks, Hemant, for the introduction. So I'm happy to see 100 people. That's a huge number, and it indicates the growing interest in integrative medicine, and from a wide variety of things from the whole eye spectrum as well as modern medicine. So what I'm going to do today is to try and expand on the use of yoga for schizophrenia, why we should think of it at all, what has been done so far, and also why, how, or rather, how schizophrenia responds to yoga therapy. So, Daivik might have explained to you about, what are the symptoms of schizophrenia. But why this name schizophrenia? It essentially means splitting the mind. That was the term given because it was recognized. Although if we talk of delusions, hallucinations, negative symptoms, positive symptoms, cognitive symptoms, and all those things, the basic problem is two things. One is loss of touch with reality. What is true and what is not true, it becomes very difficult for this person with schizophrenia to distinguish. Of course, that incorporates a lot of different symptom profiles, hallucinations, delusions. The other important aspect of schizophrenia is this schism or split between thought and effect, and also between the individual and the family or the society. I'll give you an example of a patient I saw last week in the OPD. A very brilliant young engineer for IIT Varanasi. He has done a BTech, worked in a software company for 2 years, then said that he wanted to do the UPSC and is studying at home. For the last 6 months, the family has brought him from North India, saying that he is saying that everything around him is not true. That the whole thing is inside a artificial world, and that his parents are also not his parents, and that they are monitoring him as part of the artificial world. So if people have seen the movie Matrix, this person was actually, so I actually asked him that, are you talking of something like the Matrix? He said, yes, doctor, that's exactly what I'm talking. So the whole world around me is artificial. I know that I am a pawn in this whole artificial world. And these people who call themselves my parents are actually monitoring me as part. As he was saying this, I looked at his mother. Mother actually was crying and she was feeling very upset. And I told him, you look at your mother, you are saying that she's monitoring you as part of an experiment, and look at her effect. And he was simply not able to grasp her emotion at all. This is it doesn't happen in any other disorder except maybe autism and schizophrenia, where he is a son, he has been very affectionate with her for 25 years. And now this person is in front of her saying that this is not my mother and she is using me as an experiment. So you can imagine the uh, break in reality that this person is experiencing. Otherwise, very intelligent, very articulate person uh, who has simply lost touch with this reality as well as with the family and the society. So we now think of schizophrenia as what is called as a connectopathy. So what is a connectopathy? That there is a lack of connection. It might be functional or it may be even structural. So for example, we talk of something called cognitive dysmetria, which is inability to measure how we should respond to anything. Do I respond with anger? Do I respond with sadness? Do I respond with a smile? We are not able to judge. And in fact, there are some evidence to show that there is some structural problems also in schizophrenia in relation to connections between the hemispheres. So this is what we are talking about, the most severe illness that psychiatrists treat. Now, why should we know that you have medications for schizophrenia, we use ECT for schizophrenia, we use various neurostimulation paradigms. There are enough and more treatments available for schizophrenia. But why should we think of yoga at all? Very good. Okay, hold on. I think I went too forward. Why should we think of yoga? As I said, schizophrenia is a connectopathy. On the other hand, when you talk about yoga or huge, it is exactly the opposite. It means to connect or to unite. That is the whole, origin of the word yoga. So in a sense, yoga is the opposite of the process that is happening in schizophrenia. This is a disconnection process. Yoga is a connective process. So there is some logic there. Also, there are significant limitations of our currently available treatments for schizophrenia. We know that we have very good treatments for the positive symptoms, delusions, hallucinations. We don't have very good treatments for negative and cognitive symptoms, lack of interest, lack of participation in society, disturbance in memory. We don't really have very good drugs for that. And the drugs that we do have cause significant adverse effects, which include metabolic effects, increase in blood sugar, increase in lipids, causing severe problems. Schizophrenia by itself also causes, person to become more lethargic, leading to metabolic problems. The drugs exacerbate that. And like I said, executive function is a serious problem in patients with schizophrenia. There is a lot of evidence to show elevated metabolic and inflammatory markers even in untreated patients with schizophrenia. Most of these patients also have depressive and anxiety symptoms because of the real life situation of these people. For example, this engineer, is now not functional at all. This was a person earning very well in a software company just a couple of years back. And we all very well know that stress has a very significant effect on relapse in schizophrenia. If you look at the other side, yoga has proven positive effects in all these areas that we are talking about here: cognitive performance, metabolic, problems, neurophysiological markers of stress, and even depression and anxiety. In our own institute, we have enough evidence to say that yoga is a very good treatment for both depression and anxiety. So this is the rationale for why we should think of using yoga for patients with schizophrenia. Now, this was something that Hemant was mentioning. What are the kind of studies that have been done? This was the first study. Of course, the first real study was done at SVIASA in the year 2000. Unfortunately, it is not published in a journal. Institutionalized patients with schizophrenia showed some improvement. But this was a controlled trial where people were given yoga or physical exercise, which we all do in our high school, that kind of physical exercise. Ganeshan Doraiswamy did this study as a part of his MD thesis under Dr. Gangadhar. So this was the first published study from NIMHANS on yoga for schizophrenia. And what this showed was that if you look at the second, from the top, the first row, the second graph, negative syndrome, you can see there was a significant change in the people who did yoga. The black unbroken line represents yoga group. The broken line represents the physical exercise group. So the biggest difference was in the negative syndrome and what we call as SOFS, which measures social and occupational real life functioning. So this was the first study. So what it showed us was that yoga was useful across several dimensions, particularly symptoms, functioning ability, quality of life. No serious adverse effects were reported, but this study did not have a placebo arm. So then we did a second study, a funded study to Dr. Gangadhar, funded by the Ayush department. Now, of course, it's a ministry. So we added a control group, which is a wait list. Mind you, all the groups I'm talking about here are on medication. Schizophrenia, yoga is not something that will enable you to take these people off antipsychotic. It may reduce the need for medication, but they are unlikely to be off medication. So here we added a control group, larger sample size, and we also assessed a very important aspect of schizophrenia, what we now call as social cognition or emotion recognition, which is one of the big parts of social cognition. Dr. Rishikesh Behere, who was doing his MD thesis at the time, developed a tool for that, which we call as trends. So basically, it's a set of photos and videos that express a particular emotion, and patients are asked to identify the emotion. You will be surprised to see that they make significant mistakes in common emotions, like they identify neutral emotions as angry, sad, upset, frightened, whereas the person is actually giving a neutral expression. It was done with actual actors. So this was the summary of the study. We followed up around 120 patients, trained them for 1 month. This is very similar to the first study, except that there is a bigger number and the third group. So 3 months they practiced at home, and follow-up was after 4 months. Again, we were able to show without much doubt that very significant improvement in negative symptoms as well as social and occupational functioning. This is really what we want with patients with schizophrenia. We don't need yoga to help their delusions and hallucinations that we have medication. We need yoga to help them with their negative symptoms and their functioning, and that's what we were able to show. If you look at an odds ratio, the yoga group had a 5 times greater chance of improving in negative symptoms than both the other groups, waitlist as well as the physical exercise group. Not to say that physical exercise is not useful in schizophrenia, it is definitely useful. But whereas the negative and cognitive, social cognition improved, yoga seems to be better than exercise. So this is what Hemant was mentioning, that the National Institute for Health and Care Excellence in the UK, which puts out guidelines in the UK, recognized these 2 studies from NIMHANS and added the schizophrenia as a complementary treatment, yoga as a complementary treatment for patients in 2014. Now, this was outpatients with schizophrenia. What about people who are admitted in the hospital, likely to be more severe? Can they do yoga? More importantly, can they benefit from yoga? Indeed, a thesis by Manjunath, under the guidance of myself and Dr. Gangadhar, we were able to show that within 6 weeks, people who are admitted also derived significantly better improvement in the yoga group rather than in the exercise group. So this is a supplementary study. More recently, we have been doing more specific studies for people who have primarily negative symptoms, because that is what yoga seems to help with. And this was a multi-centric study between NIMHANS and SCARF in Chennai, which is a big center for treating schizophrenia in South India. So this Narayan and Dr. Padmavati from SCARF were the people, important people in the study. And as you can see here, the effect size is a very significant 0.65, which is a fairly large effect size on negative symptoms produced by yoga. How fast does this improvement happen? This is study data from my Y-scan study, which Hemant was talking about, which we just completed some time back. And what it shows that improvement starts at 1 month, can last up to 6 months at least. Beyond that, I have not done a follow-up. I don't really know, but I expect it to continue. 6 months is a fairly good time to judge something in an illness like schizophrenia. This is a paper that we recently published on the clinical effects of yoga for patients with schizophrenia in schizophrenia research. So the data is from this. This also, of course, looked at not only the clinical effects, but also mechanisms. So as Hemant said in the beginning, I will talk about this later, but we did look at both brain imaging and gene expression kind of studies. It's not to say that only NIMHANS has done such studies. There have been studies elsewhere as well, including this study from America. Elizabeth Visivia et al. In America did a study with a small number of people. Again, were able to show that even in a group which was yoga naive, they had no idea of yoga. These are Americans. They were able to derive significant benefit in psychopathology as well as quality of life. What about yoga and what we usually call as neurocognition, memory, other cognitive functions? Rohit Bhatia and his colleagues in Delhi did this study with a fairly good sample size and show that especially for men with schizophrenia, it is known that the severity of schizophrenia is usually a little more in men rather than women, particularly negative and cognitive symptoms. And yoga again was able to show improvement in neurocognition in patients with schizophrenia. What about social cognition? Why is it so important? It's one of the critical factors for social interaction. All of us who are normal are able to judge other people's emotions without need to be told. I see somebody's face, I know whether the person is angry. If I see all of you sleeping off during the, my talk, I know that, my talk is not going on very well. But you will find it so surprising that people with autism and schizophrenia cannot judge other people's emotions, which normal people can do. And this is a very serious barrier for them to go back to work or family life or whatever it is. If I don't know whether my wife is angry with me or happy with me, it's very difficult for me to lead a family life. So we tested the effect of yoga on facial emotion recognition deficits. Rishikesh Behere, who is now in Pune, did this study, and we found a very significant change after yoga in these patients, their ability to recognize and name the correct emotion. It's not only one study, we have repeated these studies. Ram Jayam did his PhD with me and he also found this same change, that very significant improvement in the social cognition score with a very good instrument which was devised at NIMHANS called Socrates by Urvaksh, who is one of our young and brilliant faculty at NIMHANS. Of course, it's not all, there is no rose without a thorn. There are some barriers that make it difficult to reach yoga to patients with schizophrenia. Most of the patients are in the rural areas, find it difficult to come to big centers like Bangalore or elsewhere for yoga. Many people are also not attuned to the fact that a yoga intervention can help something which is a severe illness, especially in a setup like a modern medicine. So there are some barriers, not to say that everything is easy, but then there are some ways to, COVID has taught us a lot of things. As Dr. Nagaratna says, it has made us Covida in a way that we have been able to adapt, maybe online, maybe using other things. So a lot of yoga is now done online. Maybe it's one way to crack the barrier. So let's say clinical summary, yoga seems to be better than exercise in outpatients. Both exercise and yoga are better than wait list. Yoga improves not only symptoms, but social and neurocognition. Even in acutely ill inpatients, yoga was better than exercise, but there are some barriers that limit routine use of yoga in patients with schizophrenia. Now, the second part is a very interesting part for people who do research in this area. How does this happen? What does yoga do that medications are not able to do? If you look at what is changing with yoga, as I have already described to you, two major aspects of schizophrenia, that is negative symptoms and social cognition. Why particularly these two? What are the biological underpinnings of these two symptom dimensions? And how does one learn yoga? We learn yoga from a teacher, which means we imitate. We see the teacher doing and we do the posture. Then we do it mindfully. This is one of the important differences between yoga and exercise. Now we have Hemant and we have published a paper with Ramjem showing what are the differences between yoga and exercise. One of the most important things is mindfulness. And then looking at the synchronizing breathing with the movement. This we don't do in exercise. We do exercise in a way that we don't really look at what is happening with our body. You have to learn to remain relaxed, accept the posture, focus on the experience with the posture, and then add specific breathing practices. So this process of learning yoga is very important. We know that schizophrenia patients have poor social cognition. This is well accepted. Also, very interestingly, this hormone called oxytocin, which is very important for bonding, for emotion recognition, which is well known in obstetrics, because this is what makes breast milk, be able to be expressed. This is what promotes bonding between mother and child. This is low in schizophrenia. And very nice link between oxytocin and social cognition has been demonstrated, not by us. This is a study, not by, it's an international study. And very interestingly, what we found is that yoga not only improved social cognition, it increased oxytocin levels, which did not happen with people who are only on medication. This is another study by Naveen Jairam, who did his thesis with me, published it in 2030. Not only that, we went further down in the Y-scan study. Okay, how does oxytocin increase? We were able to show that gene expression of oxytocin was increased in patients who did yoga as opposed to waitlist group. Another important factor for social cognition, I don't know if people have heard of Dr. Rizzolatti, who was a brilliant Italian scientist who showed something called as the mirror neurons, initially in monkeys and later was shown in humans as well. We all have a group of neurons in the brain which are called as mirror neurons. The function of this is to enable us to learn things just by seeing, without need to understand or cognitively do it. This is how we empathize with people. If we see a child crying, most of us feel a little upset. I don't even know the child. I don't know why the child is crying, but I can mirror that emotion. This is because of our mirror neurons, and this is across all mammals. These mirror neurons are there. Very important function in social cognition. It has been quite well shown by Urvaks that mirror neuron activity is low in patients with schizophrenia, and there is also a correlation between negative symptoms and low mirror neuron activity. Very nice association here between mirror neuron activity as well as social cognition. So there is a link between underactivity of mirror neuron system, social cognition, negative symptoms. All these three are interlinked. And like I said in just 5 slides back, how do we learn yoga? We imitate. And when we imitate, it is one method of activating the mirror neurons. That is one important thing. So learning yoga from a book or an audio is not recommended. I wouldn't even recommend a video, just a video. It would always be better to have a live session. Okay, later on, maybe online is okay. But initially, you need to see the guru, imitate, and then learn in that way. So we did a study initially in healthy volunteers where we taught them yoga for a month, and we run a course in immense for our own staff and students, yoga appreciation course we call it. And before and after we tested their mirror neuron activity. And this is a sort of a map of the mirror neuron. We are primarily looking at the dorsolateral prefrontal cortex and the ventral premotor cortex. It is basically like a cap. We fix a cap and we use this technique called as functional near infrared spectroscopy. So I refer to it as a poor man's MRI because it doesn't have the complications or the expensive equipment needed for MRI, but sort of shows the same, what you would say, blood flow. It cannot reach to the depth of an MRI, but only shows the top, maybe 2 centimeters of the brain. So what happened in these people, this is illustrative, one person. What actually happened was that there was clearly increased left ventral premotor cortex activation, which indicates activation of mirror neurons. We repeated this in a small number of patients with schizophrenia as part of Shalini's thesis. Again, we were able to show the same effect, whether it is healthy person or schizophrenia. There is a clear activation of some system of the mirror neuron. So, to summarize yoga and social cognition, there is a significant deficit in social cognition in patients with schizophrenia. Yoga training increases mirror neuron activity as measured by FNIRS in the left ventral premotor cortex. It took a little longer for the patients with schizophrenia to have this effect rather than the healthy volunteers. How does this happen? Observation, imitation, connectedness with the group or the yoga teacher may also be contributing to this whole change. This is a finding from our Y-scan study. This is something that we call as the default mode network, which is a network in the brain that is dominant when we are not doing anything in particular. When we are not doing a task, the brain goes to some kind of a default mode. That in schizophrenia patients, it has been shown that they tend to mind wander a lot. They are not able to focus on anything in particular, and they have decreased self-monitoring. So how I'm behaving, they are not able to monitor themselves. What happens before and after yoga, you can see in this slide. You please look at that MRI image before and after. So before and after yoga, there is a change in the connectivity within this network, what we call as the DMN, and this increases self-monitoring and reduces mind wandering. In a sense, it keeps the person in the present rather than wandering off anywhere. So this Hemant would call this as Chitta Vritti Nirodha. So ability to control the jumping mind. This is a practical demonstration of Chitta Vritti Nirodha in patients with schizophrenia. And in addition, there is now a lot of recent findings which seem to show that yoga reduces a lot of the immune or inflammatory overactivity which has been demonstrated in patients with schizophrenia. So it is a schizophrenia. Some people refer to it as a immunoinflammatory disease as well, because there is clear information in patients. On an average, schizophrenia patients die 10 to 15 years younger than the normal population because of multiple reasons. They have higher incidence of diabetes, higher incidence of autoimmune disorders. It's a systemic disorder rather than just restricted to a behavioral paradigm. So yoga has been shown to have very significant effects on the immunoinflammatory pathway, not only in schizophrenia, in many other disorders, including depression. So putting all this together, what does yoga do in schizophrenia? Okay, the whatever mechanisms of yoga get together, there is imitation being imitated, there is increased release of oxytocin, there is improved mirror neuron activity, there is also improved connectivity between networks in the brain, possibly reduced inflammation, and together this produces improved cognition, better connectedness, reduced negative symptoms, and this leads to improved socio-occupational function. Practical tips, maybe Hemant and his colleagues will be talking to you this later. I'll just put one slide on this to say that meditation is a little bit tricky in patients with schizophrenia because we are not able to really monitor what they do when we ask them to meditate. It is better not to use intense meditation. So they need sufficient warm-up. Practices should be fairly easy for them to follow. It should be fairly dynamic, and breathing, they should be asked to focus on the present rather than try to meditate and wander off somewhere. You can have, jogging, twisting, dynamic sun salutation. So we have a validated yoga module for schizophrenia developed by Dr. Ramjem and, our group, which has all these. So we do not usually ask them to meditate. For example, Vipassana, which is a very difficult kind of meditation, may not be advisable for patients with psychosis because of multiple reasons. One is, of course, psychological, that when your mind is disturbed, you try to meditate, the attention goes to what is troubling you. Number two, if you look at it biologically, both schizophrenia as well as meditation increase dopamine levels. And this is, so logically, it can worsen psychosis in some people. So that is some caveat for patients with schizophrenia, that meditation may not be a good thing. So long, intense meditation with eyes closed is not a good idea for patients with schizophrenia. So to come to the end of my talk, yoga-based interventions have shown efficacy as adjuvant treatments. This word adjuvant is important. I am not recommending any schizophrenia patient to stop medication just because they are doing yoga. It may be possible in some disorders like mild anxiety and depression, but in schizophrenia, they do need their antipsychotics. What are the aspects of schizophrenia that tend to improve with yoga, particularly negative and cognitive symptoms? How does this happen? Modulation of the hormonal, neurohormonal axis, including oxytocin, mirror neuron activity, connectivity in brain networks, and also the immune inflammatory pathway. But there is a lot of work remaining to be done in this area. Much of it is being done in IMHANS as we talk, but in other centers also, hopefully. Of course, this work is not my work. It's a work of a team and our collaborators, funders, Dr. Gangadhar, who was the pioneer behind all these things, Dr. Venkat, who is my colleague in the Department of Psychiatry, the yoga team and the integrative medicine team, and of course our collaborators, including the Art of Living, the SVASA, MDNAY, and the Ministry of Ayush, have to be thanked for all these findings. Thank you. I'd be happy to take some questions if Hemant feels there is time.
Yes, sir. There is time, and students, can unmute and ask their questions to sir.
I hope it was. I tried to make it fairly simple to understand, in the sense that how we think of schizophrenia and how yoga can help this disorder. That was my focus for today.
Yes, sir. I think sir has covered very beautifully, in a way that all of us can easily understand the major mechanisms through which schizophrenia, would be improved by the practice of yoga. If there are any, I don't see any question. Yeah, Akash. Akash, please introduce yourself.
I wanted to know.
Yes.
Sir, my name is Akash. I am working currently in Art of Living Sri Ayurveda Hospital in the naturopathy setting. I graduated from BNYS in SVSA University just this year of April. So I had been to Nimans for my internship also. I have seen Shivarama sir, and so nice to see you again, sir. My question, sir, was the mirror neuron activation that you told, which happens with the trainer in yoga. What effect does it have on the neurotransmitter, on a neurotransmitter level, sir? Like, does it activate the mesolimbic pathway or any of the dopaminergic pathways, sir?
So the original dopamine theory of schizophrenia is now, of course, there is dopamine abnormality in schizophrenia, but it does not seem to be the primary problem. The dopamine also is an epiphenomenon of something else which is happening. So for example, the negative symptoms, we say that it is because of hypodopaminergia in the, frontal pathways, but the primary problem with schizophrenia seems to be actually more related to glutamate. So dopamine and glutamate are very strongly linked. We have not been able to find a good way to measure the changes in glutamate. Dopamine we can still somewhat track or whatever it is, but glutamate not able to do. So what tends to happen in schizophrenia is that neurotransmitters are epiphenomena. They are not the cause of the schizophrenia. They are the mechanism by which symptoms are produced. But what is the true thing is that there is something we call as salience. So the ability to recognize the important stimuli and disregard what is not important. So if you want, you can, to put it simply, we can call it as a mental filter. So mental filter is, okay, let's say I am in a railway bogie, there is so much noise, there is smell, there is galata going on, but I am able to read my book and watch the other people without getting upset. Whereas a person with schizophrenia, for example, with all this stimuli, may start thinking that the person is smiling at me, people are making gestures at me, everything is happening to trouble me, right? So this is the loss of salience, and that primary driver is glutamate. So there is something called aberrant salience. So the mirror neuron activity is not really linked to dopamine in any way. It looks like it is more linked to the ability to look at emotion. So that is oxytocin. To some extent, maybe it involves serotonin, but not really dopamine. So that's why I said what we are talking about here is not really positive symptoms. What we are talking about here is negative and cognitive symptoms, which don't have much to do with dopamine. It's a completely different thing. And if you ask neuroscientists now, they say schizophrenia primary problem is not positive. That's just a way that the disease comes to attention. The primary problem is cognition and lack of drive, right? So mirror neuron doesn't have anything to do with the dopamine system.
Yes. Dr. Meena, would you like to ask something?
Yeah, my question was whether the 6-month study had the people continuing yoga, or was it only 1 month yoga and the effect for 6 months?
No, madam. They were supposed to continue at home. 1 month was the training period, and they were supposed to continue for the next 5 months. This is the standard in most of our studies. It's also related to the length of the effect of yoga. What we have found in our appreciation course and most people is that, and there is some research from outside as well, which says that the effect of one yoga session lasts anywhere between 5 to 7 days, not more than that. And if you really want the benefit of yoga to continue, the minimum duration of doing yoga frequency is at least thrice a week. Without that, the effect of yoga tends to slowly go away with time. So indeed, yoga is something that you have to continue, just like any other. It's so with medication as well, isn't it? So it's important to realize that it is not that you do yoga and then you leave it. But if you look at it in another way, that is really what we want. Because, for example, we have a study in depression which showed that people who are doing yoga versus people who are taking medicines, both the symptoms of depression improve. But what happened with the yoga group is that the level of cortisol, which is the stress hormone, actually went down in the people who are doing yoga. This did not happen in the group who took medicine. The depressive symptoms improved. Now, what do you expect to happen when they stop the medicine? The stress is still there, cortisol is still high, they would go back into depression. We expect yoga to be different simply because it is a life-changing kind of a practice. It becomes part of your life. Otherwise, if you do 1 month yoga and leave it, it is not going to really change. For that matter, even the most potent intervention that we have, ECT, for example, ECT does very much help in the acute course of schizophrenia, but it does not change the course of schizophrenia. So you have to employ it as a lifestyle practice to get the long-term benefit.
Thank you.
Thank you. Thank you very much, sir. We will take one last question, which is there in the chat box. Dr. Sujata, has asked, how do we, ensure compliance with yoga in mental health patients?
So it's a very difficult question, one which we struggle with daily, because this is one of the few illnesses, group of illnesses where the person is not really bothered nor aware of the symptoms. Whereas in depression and anxiety, the person will come to you and say, please make me better, I have a problem, do something. Schizophrenia, the person most of the time is not even aware that he has or she has a problem. So it's a very difficult thing to convince somebody who doesn't believe there is a problem to take any treatment. So the only effective strategy that we have found till now is to involve the person in the treatment, right? Because if you are saying, okay, you have an illness, I'm going to give you a medicine, you have to take this medicine for the next 5 years, which person is going to like it? You have to involve the person by saying that, okay, where is your life going? What is happening with your life? What is happening with your family? What's happening with your education or your job or whatever it is, How can we help you to get better in that? As a part of that, I would like you to take your medicine, it might improve your focus. I often discuss this filter, what I was telling Akars today. I often discuss this filter theory even with patients. I say, what is actually happening with you is that you are not able to focus on what is important. You are focusing on a lot of things which are maybe not really important. So this medicine will help you get back your focus on the things that are really important in your life. Along with that, what are you going to do? Taking medicine is a very passive experience. Any of us, if somebody tells you take an antibiotic for 15 days, by the 10th day, most of us will forget it. Because it's not coming from inside. It is imposed from outside. So I ask them, okay, what are you going to do? You tell me what you going to do to get yourself better. Then the person may say, okay, I want to join this course. I want to do. Say, okay, that's yoga is like that. It is your way of contributing to yourself getting better. Then compliance is likely to be more. So you have the most important aspect of a psychiatrist while treating this kind of illness is the time he or she gives to the patient. To diagnose schizophrenia, you don't have to be brilliant at all. Even the most idiotic psychiatrist can diagnose schizophrenia. Getting the person involved is very tough. You have to spend a lot of time with the person, explain to him, and then of course, there are other pharmacological methods of improving adherence, like long-acting medications, injections, for example, paliperidone, which is already there in India. In the US, there is a 6-month injection of paliperidone, which is already there. So you only need to give the injection once in 6 months. So if somebody had brought that for diabetes, that person would be worth a Nobel Prize and probably a billionaire by now. So in fact, my colleague Dr. Venkat refers to schizophrenia as diabetes of the brain. So it is somewhat like diabetes. I often give this analogy of diabetes to explain to patients that it is something like diabetes. In diabetes, the problem is here. In schizophrenia, the problem is here. That's the only difference, And then you have to tell them that, it's a very common thing. Somebody develops diabetes, somebody develops hypertension. You have developed this illness. It's not your fault that you have developed the illness. But if you don't do anything to get yourself better, maybe you are at fault as well. And then they usually, are able to sort of listen to you and take the treatment.
Yes, thank you. Thank you very much, sir. This was a very insightful class, and all of us learned a lot from your rich experience. Thank you, sir.
So I'll probably send this slide as a PDF to you, Hemant, if you can share with the audience.
Yes, sir. Yes, sir.
All right. Okay. All the best. See you sometime later. Thank you.
Thank you, sir. Okay, dear friends, please get ready for the quiz now. So this is the QR code, or you can go to slido.com and put the number to log in. Okay, so I see 79 people out of 106. I request everybody to log in. $89 people. Fine. I hope all of you are ready. I am going to start the quiz now. Get ready for the first question, which is going to come on your screen now. Which of the following chanting is recommended in yoga practice for schizophrenia with predominant negative symptoms? The time that you take to respond also affects your ranking. So the majority says 48%. In schizophrenia with negative symptoms, person is mostly withdrawn within and the person has to come out. And we all know that the sound A is associated with the outward movement of the consciousness, and that is why A is the correct answer. A sound, that is what we do in between each of the practices in the schizophrenia short capsule that we shared with you. Next question. Which of the following major property of the herb Brahmi leads to its positive effects on mental function? How does Brahmi act and improve mental function? What is the major mechanism? Very easy question actually. Yes, major mechanism through which Brahmi works, not only in schizophrenia but in dementias also, is through its antioxidant effects. Next question. According to Acharya Vagbhata, what should be done if all medications for Unmada such as Vamana and Virechana fail, all procedures fail? What would you do? Oh, wonderful response. So if this doesn't work, you need strong stimulating medication, and there should be nasal instillation of those medications. Directly trying to reach the upper part of the body is what is recommended. So majority is correct. Next question. The Unmada caused due to affliction of gods, Gandharvas, Pishachas, Yakshas, Rakshasas is termed under which category? Agantu, Sannipata, Bhutonmada, Vataja Unmada. Though we put it under dissociative disorders. Yes, so the correct answer is Agantu Unmada. Bhutonmada represents some special powers that the person shows, but typical term in Ayurveda where there is some external force that possesses you that we categorize as dissociative conditions, that is Agantu Unmada. It has been described in the chapter that I shared with you. Next question. In Vataja Unmada, if there is obstruction of channels, how would you open it, or which Shodhana Chikitsa will you prefer? Vata type. Yes. So intense exercise, fasting will further aggravate Vata. Purgation is predominantly given for Pitta. Vata is addressed by enema procedures. Next question. In the review article that we shared, there was some evidence for all of them, except one in Unmada. Which one is that? Super. So Tagara also, there was some evidence. Ashwagandha, Brahmi. Tagara is actually good in relaxing the mind, improving quality of sleep also. But Guduchi is more of a, you can say, immune modulator. Though immune system also plays a role in schizophrenia, but there was no evidence so far. There has been no evidence using this herb. So majority is correct. Next question. In the brief video that I shared, which of the following is not there in the brief yoga capsule for schizophrenia? Super. So instead of Kapalabhati, which was not feasible, the module has Bhastrika. All others are there. Sarvangasana is also there. In fact, inverted poses require more balancing and promote the pramana vritti. To remain in the present moment, these balancing asanas are actually useful, like Sarvangasana. Next question. Number of sun salutations recommended in schizophrenia module. The brief capsule that I shared with you. What is the number? 4 slow, 4 fast, 5 slow, 5 fast, 3 slow, 3 fast, or total of 4 rounds of sun salutations. Wonderful. So 67% of the people have read, the details properly, have seen the module. 4 slow and 4 fast is the optimal. Beyond that, they feel more fatigue. Less than that may not be effective. Yes. Ninth question. For better relaxation, the ratio of inhalation to exhalation in deep abdominal breathing should be. Wonderful. So almost, 77% people know you breathe in for 4 count, breathe out for 8 count. That brings the parasympathetic dominance in the system and is the best breathing ratio to relax deeper. Last question, everybody, please get ready. The most difficult type of Unmada to treat is Vataja, Pittaja, Kafaja, Sannipataja. Very easy question. Wonderful. So 88% Sannipadaja is combination of Vata, Pitta, Kapha together, and it is more severe and very difficult to treat. So I'm glad, people have done very well in the exam today. Almost 70-80% of you have done it. And today we have Meena Madam. Meena Madam have topped the exam, taking the least time. All of them have scored 10 out of 10 though. So I request Meena Madam to please unmute and share her feedback. Okay, thank you. Thank you. So Meena ji, congratulations. Dr. Rashmi, many congratulations. Dr. Anju, very less time difference, only 0.4 second difference between Dr. Rashmi and Dr. Anju. Then we have Dr. Soni George and Dr. Sharada. Any one of you would like to unmute and share your feedback? You are welcome.
Good afternoon, sir.
Yes.
So this is Dr. Rashmi.
Yes, madam, please.
Very interesting classes are going on, sir, because we had I'm a Ayurveda graduate and I've done MD in Shalakhetan, that is about ENT and eyes.
Oh. And where are you working currently, Dr. Rashmi?
In Dharwad, sir.
Okay.
In Karnataka itself, Dharwad, I'm working as an assistant professor.
Wonderful.
And a small clinic too.
Okay.
So
are you finding the course useful?
Yes, sir.
In
Very less
what way?
exposure to.
Yes.
In psychiatric disorders, we had very less exposure, sir. So it was a good opportunity for me to learn about these disorders.
Okay. In Ayurveda, I think in Charaka Samhita, there is only one chapter that is dedicated to the mind-related illnesses, is it?
Yes, sir. Unmada, and we have one more chapter called Apasmara.
Apasmara, yes.
Which can grossly be correlated to epilepsy, but there also we have more of psychiatric symptoms also. So there also we have references of treatments.
Correct. So though the general guidelines of general Kaya Chikitsa is followed here, but specifically in this area, Nimans has started a MD in Manas Roga. So here,
yes, sir.
Those Ayurveda graduates who are coming, they are being exposed to mental health from Ayurveda perspective, from yoga perspective, from psychology and psychiatry perspective, and neuroscience perspective. So in that way,
few Ayurveda colleges, we also have PG in Manasarogas.
Oh, which college, madam, this is?
STM Udupi, STM Hassan, and few other colleges, we have a separate department PG also, sir. Manasaroga.
But this is not a very common MD. It is not there in all medical colleges, no? Manasaroga MD?
Yes, sir. It is there in, yes, sir. It is there in very few colleges.
Okay, but I think this is very important, need of the hour,
yes,
considering the epidemic of mental health problems that is coming
yes,
over
sir.
the globe. So very well done, Rashmi. Nice talking to you.
Thank you, sir.
Thank you.
Yeah. I just wanted to add that actually I have used ashwagandha for menopausal syndromes. Very, very promising results. I know it's out of the book and out of the context, but I just wanted to know how do the Ayurvedic specialists feel about it, actually.
So you found ashwagandha useful in managing the perimenopausal symptoms?
Yes, menopausal, perimenopausal, post-surgical, because I have a set of patients, normally diabetic hypertensive, who come back for any problems after even hysterectomy. So I just wanted to know their view about it.
Which symptoms improved with ashwagandha, madam? In your
almost everything except, I mean, the flushes I said to forget. The flushes, I asked them to forget about it, and the rest of it, most of it was adjustment issues with the physiology and the psychology. I don't know. They have done very well.
Okay. So any Ayurveda faculty here in the team would like to talk about the properties of ashwagandha and how, you know, for these menopausal, perimenopausal women, it was useful. Okay. Would anybody like to share their views? Any Ayurveda faculty? Dr. Soni George.
Sir, hello.
Yes, please.
Ashwagandha can reduce cortisol. So cortisol means it will, once it is reduced, the stress will be automatically reduced and all the mood-related symptoms will be coming down. That can be the reason why doctors finding it is very effective.
That is modern mechanism, madam. No, Ayurveda.
Ayurveda mechanism. Okay, sir. Actually, we feel like it is like pitta. It reduces vata and kapha. That is the kapha. In doshic way.
Okay.
So that's why we tell in hot flushes, no, it won't show result because it will aggravate pitta only.
So except flushes, the vata, kapha,
and kapha related symptoms
reduced by ashwagandha.
Yeah, some experts can add actually.
Okay. We have faculties, Dr. Deepa, Ayurveda faculties, yes. Or we will ask Kishore sir only. Okay, so let us ask Kishore sir.
From the allopathic perspective, yeah, what she said, it's the adrenals that are short during perimenopause and menopause, especially, and that's how it works.
Okay.
And it works for so many stress-related conditions. For so many conditions, it works well because of that reason.
Yeah, it is something new that I have learned from Dr. Meena today, and we will also try to use it in our clinical settings. So far, in our experience, we have found ashwagandha to be quite useful in reducing anxiety. We have found ashwagandha useful in reducing negative symptoms in schizophrenia and in improving quality of sleep in the night. Ashwagandha was also useful in individuals who showed anxiety due to Dhat syndrome. In the cultural setting, that we read in anxiety. So these were some of the areas where we found it useful in our setup. Now let us listen from Professor Kishore Kumar. Professor Kishore is the head Department of Integrative Medicine, NIMHANS, and sir is going to talk to us about the management of Unmada from the Ayurveda perspective. I hope sir is here. Kishore sir, are you there?
Yes, Hemanji, I am here. Thank you.
We will make you a co-host, sir. I request the host to make Kishore sir co-host. Yes. Sir, just a brief background. Our students in CCIM course, they have completed, the basic understanding of major Ayush systems. They have completed depression, anxiety, and now we are in substance use disorders. Now we are looking into psychotic illnesses. And already Dr. Devik has taken a class on introduction to psychotic disorders. I have taken a class on yogic understanding of psychotic disorders. And Shivaram sir has spoken about the research in the mechanism of action of yoga in schizophrenia. These students, they have read about the, the Charaka Samhita chapter on management of Unumada, and they had some doubts that they wanted to ask. So before we go into that, Dr. Meena actually shared her clinical experience with us, and we wanted your input on that. She said that she found ashwagandha very useful in managing the symptoms of perimenopausal women, and post-menopause also it showed good improvement. So I was wondering what may be the mechanism. Does ashwagandha have some phytoestrogens, or what is it? What is your clinical experience with ashwagandha and menopausal women?
Thank you, Hemanji, for those kind words. So